Hi friends, today we will see some important previous year questions from endocrine system. First question, hormone produced in allergic reaction is option A glucocorticoid, option B mineralocorticoid, option C norepinephrine, option D epinephrine. Here the correct answer is option A glucocorticoid. Glucocorticoid is particularly a cortisol. It is mainly produced during the time of allergic reaction. So the correct answer is hormone produced in allergic reaction is glucocorticoid. Second question, hormones of adrenal cortex are synthesized from options are option A thyroxine, option B tryptophan, option C cholesterol, option D glycoprotein. The hormones of adrenal cortex are synthesized from cholesterol. Here the correct answer is option C cholesterol. Third question, acromegaly is most frequently diagnosed in option A children's 2 to 5 years, option B newborns, option C middle-aged and adult, option D above 65 years. Here the correct answer will come middle-aged and adult. Why? Acromegaly is an hypersecretion of growth hormones which is occurs in adult. So the correct answer is middle-aged and adult. In hypersecretion of growth hormones in children causes gigantism. In adult it is causes acromegaly. So here the correct option is middle-aged and adult. Fourth question, moon-shaped face is seen in options are option A acromegaly, option B Cushing syndrome, option C Addison's disease, option D myxedema. Here the correct answer will come option B Cushing syndrome. The main manifestation, one of the main manifestation of Cushing syndrome is the fat deposition over the face. Due to the deposition of fat, patient face will like a puffy, that is little like a round moon shaped face. Okay, so moon shaped face is coming in case of Cushing syndrome due to the deposition of fat. Fifth question, endocrine disorder may be triggered by all of the following except. Options are option A damage to an endocrine gland, option B infections, option C tumors of one or more endocrine gland, option D cell phone use. Here the correct answer we can select from this option is option D cell phone use. Remaining all the options damage to the endocrine gland, infections, tumors of one or more endocrine gland, these all related to various endocrine disorders, but cell phone use directly or indirectly will not affect the endocrine gland. So correct answer will come option D cell phone use. Sixth question, the endocrine gland responsible for body circadian rhythm is options are option A thymus gland, option B pineal gland, option C parathyroid gland, option D pituitary gland. The body circadian rhythm is maintained by option B pineal gland. That is our sleep wake-up cycle, that is day and night cycle of the body is maintained by pineal gland. That is circadian rhythm is mainly maintained by pineal gland. Seventh question, the client with Cushing syndrome needs to modify dietary intake to control symptoms. In addition to increase protein, which is most appropriate? Options are reduce fat, option B restrict potassium, option C restrict sodium, option D increase calories. A client with Cushing syndrome has to modify their dietary, that is body fat deposition will come in her patient's body. So in order to increase the protein, along with the protein, patient should restrict the sodium, that is puffiness will come on the body. So in order to intake along with the protein, patient should avoid sodium rich diet. Move on to the next question, eighth question. Which part of the brain with the greatest influence over the endocrine system? Options are option A hypothalamus, option B amygdala, option C cerebellum, option D medulla oblongata. Here the correct answer will come option A hypothalamus. The part which have greatest influence over the endocrine system is hypothalamus. Option A. Next question, ninth question. Which of the following hormone is a modified amino acid? Options are option A prostaglandin, option B estrogen, option C epinephrine, option D progesterone. Here the correct answer is option C epinephrine. The hormone which is modified amino acid is epinephrine. Next question, during diabetes insipidus, serum sodium level. Option A increases, option B decreases, option C remains normal, option D none of the above. In case of diabetes insipidus, due to the deficiency of antidiuretic hormone, vasopressin causes diabetes insipidus. In case of diabetes insipidus, kidney can't maintain the water in body, so along with the water, sodium also decreases in the body. So here the correct answer will come sodium option B decreases. Sodium will decrease in the body. Move on to the next question. 12th question. Acromegaly occurs due to option A hypopituitarism, option B hyperpituitarism, option C decreased secretion of thyroxine, option D decreased secretion of insulin. Here the correct answer is hyperpituitarism. Due to hyperpituitarism, acromegaly occurs. Next question, the hormone secreting cells called neurosecretory cells are abundant in option A hypothalamus, option B amygdala, option C cerebral cortex, option D medulla oblongata. The hormone secreting cells called neurosecretory cells are abundant in hypothalamus. Option A hypothalamus. Move on to next question, 14th question. Thyroxine and triiodothyronine produced by the thyroid gland are synthesized from iodine and dash. Options are option A phenylalanine, option B cholesterol, option C glycoprotein, option D tyrosine. Here the correct answer is option D tyrosine. Next question, example of heterocrine gland is. Options are option A pituitary gland, option B pancreas, option C thyroid gland, option D parathyroid gland. Heterocrine gland means both exocrine and endocrine gland is pancreas. Correct answer is option B, pancreas is heterocrine gland. Move on to the next question. Which of the following signs and symptoms are expected from a client with diagnosis of hypothyroidism? Options are option A increased blood pressure, option B moist and coarse hair, option C tachycardia and weight gain, option D hypothermia and constipation. Here the correct answer is option D hypothermia and constipation. So the clinical manifestation of patient with hypothyroidism is cold sensitivity skin and also patient is having constipation. So option D is the correct answer. Next question, ACTH stimulation test is used to diagnosis. Options are option A Graves' disease, option B cystic fibrosis, option C adrenal insufficiency, option D Hashimoto's disease. ACTH means adrenocorticotropic hormone. Adrenocorticotropic hormone stimulation test is used to diagnose adrenal insufficiency. Option C is the correct answer. Next question, Zona glomerulosa of adrenal cortex is involved in. Options are option A water and electrolyte balance, option B carbohydrate metabolism, option C peptide hormone secretion, option D all of this. Zona glomerulosa of adrenal cortex is involved in water and electrolyte balance. Option A is correct answer. Move on to next question, 19th question. Which gland is also called brain sand? Options are pineal gland, option B thymus gland, option C pituitary gland, option D thyroid gland. The gland which is called brain sand is option A pineal gland. Pineal gland is known as brain sand. Move on to next question, 20th question. Low level of estrogen and progesterone in blood stimulate option A FSH and LH production, option B LH production, option C GH production, and option D all of this. Here the correct answer is option A FSH and LH production. When the blood level of progesterone and estrogen is decreased, it will stimulate the production of FSH and LH. Move on to next question. Hyperthyroidism may cause option A tachycardia, option B bradycardia, option C loss of appetite, option C constipation. So in hyperthyroidism, the clinical manifestation mainly one of the main manifestation is tachycardia, option A. The other manifestation is loss of hair, bulging eyes, frequent sweating, and enlarged thyroid gland, increased appetite. So along with that, tachycardia also occurs.